With the geriatric exam, we do a lot of the same things that we would in a younger animal. So it's overall just a surveillance of their health. With the geriatrics, we're maybe a little bit more intense and we sort of target certain things that might give us indicators of some of the chronic diseases that we see in that species. With his advancing age, we want to try and catch any health concerns early so that we can try and address them before they become really serious. He has a history of just struggling to completely groom himself, especially along his back and his tail. So one of the first things that we started to do was check out whether he had mats along his back. It's really common in domestic cats for them also to struggle to properly groom themselves as they get older, or even if they're a little over-conditioned. You know, if they have a bit of a big belly, sometimes it's hard for them to reach all the way around. So with Bijou, very similar to a domestic cat, we were finding mats in those areas where it's just a little bit difficult for them to reach. At least on a quick peek, it looked like he had minimal arthritis, and he also had really good fat stores. We've been trying to get him to lose a little bit of weight just to try and help with his joint mobility as he ages. And then we'll go back and have a better look at his lungs and his heart, as well as the abdominal organs that we can see on X-ray. One of the major concerns that we always have with elderly cats is kidney function. Just like in domestic cats, it's really common for our other wild felids to also have issues with their kidneys. So we took a urine sample from Bijou and we took blood from Bijou. There was a couple things on his urine sample that indicate that he could have a mild urinary tract infection. So we're going to send the sample off to the lab as well, just to have a complete analysis of his urine and kidney function, because we want to try and catch any of those little things early on and treat them. As they get older, we sometimes have old cats who, probably because they're scratching less, they're using their claws less, they sometimes will get claws that grow into their pads, grow into their foot. So with Bijou, because of his age and also because some of his claws were starting to look rather thickened, we were trimming a little bit of the claw off and trying to break the excess sheath off of the sides of them so that they're less likely to result in an ingrown toenail. Bijou, for a 17-year-old lynx, is doing really well. We didn't find anything glaringly scary on his geriatric exam today. He's doing really well clinically as well. So yeah, for a 17-year-old lynx, he seems to be doing great.